Hey everyone, welcome back to the deep dive. You know how it is, you're busy, you want to stay informed, but there's just so much information out there. It's overwhelming, right? Well, that's why we do these deep dives, to cut through all the noise and get you the most important takeaways fast. Today we're tackling the bEHR Health app, specifically their health score. We got our hands on some pretty in-depth information about it. Our mission today, pretty straightforward. We want to figure out why bEHR Health really pushes users to update their health score every month, and more importantly, what happens when you do? What's the real impact of that?
Yeah, that's a really good question, right? I mean, we see apps all the time asking us to do things, track this, update that, but we don't always know why. So we're going to go beyond just using the app. We're going to look under the hood and see how it all works, what that data means, both for you as an individual user and then zooming out for the whole community.
I'm really interested to dig into that. All right, so bEHR Health. It's a healthcare startup. Got its start with connections to Xavier University of Louisiana. The founder is actually a Xavier alum, Kwame Terra. And one thing that immediately struck me about bEHR Health is their mission. They're really aiming to create a comprehensive healthcare resource that specifically weaves health into Black culture and helps people navigate the systemic challenges within the healthcare system. I mean, that's a huge undertaking. It feels like a really important foundation to be working from.
It is, yeah. And their main tool, the way they're trying to achieve this is through the Bear Health app. So the core of this app is the health score. But it's not like, some other schools where you just get a number and that's it. This score is meant to be something that you interact with. It's designed to be a tool for you to track your own health journey, but at the same time contribute to community health solutions. It's both individual and collective.
And that's where the monthly updates come in, right? The whole idea of updating your health score every single month. That's a key part of what bEHR Health emphasizes. So what's the thinking behind that? What are the reasons they want us to engage that regularly?
Yeah, there are actually several reasons, and they all kind of connect in interesting ways. I mean, for you, the user, the most obvious reason is to track your progress over time. Think about it. Your health is constantly changing, right? Your mental well-being, physical health, all of it. And when you update your score monthly, you're basically creating a record of that. You can see how things are moving, whether it's your mental state, nutrition, even self-control, mindfulness, things like that. Plus, it automatically tracks physical activity and sleep. So
Hmm.
you're building this really detailed picture of your health. It's almost like a personal health barometer that you're actively contributing to.
So it's about being engaged, not just passively tracking, but actually being a part of the process. And then the second reason they list is stay honest with yourself. I like that. It kind of implies a level of accountability.
Absolutely, yeah. Life happens, right? Maybe you've been stressed, maybe you haven't been eating as well as you'd like. That monthly check-in, it's like a reminder, a chance to reflect. Okay, what's been going on? How have my habits been? It encourages you to be honest with yourself about those changes and then hopefully make more conscious decisions about your health moving forward.
Okay, so those first two reasons are very much about the individual experience.
Yeah.
But then they shift to the broader community impact. The next few reasons are all about that. They talk about your data contributing to something called the health score report. Can you break it down a little? What is that exactly?
All right, so this is where it gets really interesting. It's like the individual becomes part of something bigger. So your data, it's all anonymized, of course, but it's combined with everyone else's data who's using the app and updating their score. And all that data together forms the health score report. Now, this report, it's basically a real-time snapshot of the community's health. And by analyzing that data, they can start to see trends, identify areas where there might be gaps in care or where resources are most needed.
That's pretty cool. So like even though my data is anonymous, it's still helping to paint this bigger picture of community health. And that can then inform like where resources are directed. That's powerful. And the fourth reason they give is driving real world change, which builds directly on that idea. How does that work in practice?
Right. So it's not just about collecting data, it's about using that data to make a real difference. So Bear Health says they use the insights from the health score report to make decisions about where to invest in physical infrastructure, things like building new clinics, community health centers, even fitness studios. They also use this data to advocate for better health policies, policies that actually address the needs that are revealed by the community's data. So your monthly update, it's not just a number, it's potentially having a real impact on the resources and policies that shape your community's health.
So it's like, in a way, your data point becomes a vote, a voice in determining what kind of healthcare support is most needed in your community. The last reason they give for updating monthly is to ensure the app works for you, which sounds more focused on improving the app itself.
Exactly. It's like a feedback loop. The more people use the app and update their score, the more data Bear Health has to work with. And that allows them to refine the app, make it better, more relevant to your needs. So they're constantly looking at how people are using it, what the data is showing, and using that to improve the features and the support the app offers.
It's all connected. And that brings us to their core belief. We can't improve what we don't measure. That's a pretty straightforward statement, but it really highlights how important this data is.
It does, yeah. It goes back to what we were saying earlier about looking under the hood. It's about understanding the mechanisms at play, the importance of data in driving change, both at the individual level and at the community level. And the health score report, it's like a dynamic tool that allows them to get those insights in a way that's constantly evolving, constantly updating.
And they make a really interesting point about traditional public health data. Analyzing that kind of data can take months, even years. But the health score report, it's updated in near real time. That's a pretty big difference.
Yeah, I mean, think about it. Traditional data, it's often looking backwards, right? It tells you what's already happened. But this real-time data allows Bear Health to be much more responsive. They can see trends as they're emerging, identify potential issues early on, and then intervene more quickly and effectively.
Right. It's like proactive versus reactive. And Kwame Terra, the founder, he talks about how this gives them a way to really see the health of their community in a way that goes beyond traditional metrics. Not just looking at things like hospital admissions or disease rates, but getting a much more nuanced and complete picture. And he sees this as a way to empower people, to give them the tools to actively shape the future of Black health.
It's a powerful idea, right? To be able to see what's happening in your community, to understand the challenges, and then work together to create solutions. And it's interesting because they point out that, there's all this incredible work happening on the ground, grassroots initiatives, community organizations, things like run clubs, Girl Trek, all these amazing efforts, but they haven't always had a way to measure the impact of that work.
So all that energy and dedication, we don't always know if it's having the lasting impact that we hope for.
Right, exactly. And that's the gap that Bear Health is trying to fill. They want to create that unified system, that way to actually quantify the impact of all these efforts to improve Black health. And if you can measure it, then you can start to see what's working, what's not working, and then figure out what needs to be scaled up, what needs to be replicated in other communities.
So those monthly updates, they become even more crucial in that context.
Sure.
It's about building that reliable, up-to-date data set. And Bear Health really encourages users to be honest and reflective when they update their score. They ask you to think about how you've been feeling, if your habits have changed, if there are areas where you need more support. It's not just about clicking buttons, it's about taking a moment for self-assessment.
Right, because the more honest and accurate the data is, the better those insights will be, both for you personally and for the community as a whole. And they make it pretty easy to do. They have clear instructions in the app on how to update your score. You just go to the different categories, things like mental well-being, physical health, nutrition, all that, click update my answers, and you're done. And for things like physical activity and sleep, it tracks that automatically, so you don't even have to think about it.
Which is great because the easier it is, the more likely people are to actually do it, right?
Yeah.
And that's what they want. They want this to be a regular part of your routine, not a chore.
Exactly. And it goes back to that idea of connecting your individual health to the health of the community. They have this tagline, your health, your community, your future. It's about recognizing that those things are intertwined, that your individual well-being is part of a larger ecosystem.
It's a powerful message. So I think taking a step back, looking at all of this, what we see is that those monthly updates to the health score, there's so much more than just a personal check-in. It's about contributing to this collective effort to understand and improve community health in a way that's never really been done before.
Yeah, I mean, we often think about data as being cold and impersonal, but in this case, it's being used to empower people, to give them a voice in shaping their own health and the health of their communities. It's a really interesting model.
It really is. All right, so listeners, something to think about as we wrap up. Consider the power of your own data. What if, by consistently contributing these small monthly inputs alongside countless others, we could actually change the future of healthcare for an entire community? It's a pretty radical idea, but Bear Health seems to be making it a reality.